If you have been diagnosed and treated for Facet syndrome, these self-care protocols will be tremendously helpful in your recovery process. Set aside 1 to 3 days to concentrate fully on these breathing, stretching, and strengthening exercises. Do not engage any other exercise during this period. Resume normal activities only after being stable and pain-free for a full day. 3 key rules. Use protective belly breathing during painful movements. Stretch before standing if you've been immobile for over 45 minutes. After stretching, complete at least 10 strengthening repetitions. Facet syndrome can provoke intense low back pain with certain movements, such as rolling over in bed, bending forward at the waist, engaging the abdominal muscles, standing up from a seated position. For this reason, we highly recommend belly breathing, which acts as a brace for the lower back to protect against intense pain of Facet syndrome. Many believe deep breathing involves expanding the rib cage and lifting the shoulders. A real deep breath engages the diaphragm, causing the belly to expand. Breathe to the bottom of your lungs, hold your breath, move your body as needed, then exhale. Next, we'll show a stretching exercise you can do while laying down. If you've been still for over 45 minutes, stretch before getting up. The longer you've been immobile, the longer you may need to stretch. As you will see, wearing pajamas to bed will make it easier to stretch in the morning. Use the belly breath as needed. Grasp your pajamas and pull to bend your knees, then exhale. Pull one leg up to your chest. Pull as close to your chest as possible. Hold for 5 to 10 seconds. Now pull the other leg up to your chest. Pull as close to your chest as possible. Hold for 5 to 10 seconds. Repeat this sequence a few times, going right then left. Pull your knee up as close to your chest as possible. Hold for 5 to 10 seconds. If needed, employ a deep belly breath while raising and lowering your legs by holding your pajamas. Exhale when your feet are back on the bed. Next, pull both legs towards your chest. Pull them as close to your chest as possible. Hold this stretch for 10 seconds. The longer you have been laying down, the longer you should stretch. You may need to do this 3 to 7 times in the morning. The following sequence outlines the recommended method for safely exiting a bed. Begin by bending both knees. Inhale a deep breath into your belly, holding the breath momentarily. Gently rotate your knees and torso to the side of the bed from which you intend to rise, then exhale. Take another deep breath and hold. Initiate the process of sitting up by pressing your torso upward with your right hand, then use your left hand to assist. Simultaneously, allow your legs to lower off the bed, then exhale. When rising from the right side of the bed, first bend both knees. Take a deep belly breath and hold. Gently roll onto your right side. Exhale and take another deep belly breath. Position your left hand, palm down, near your right shoulder. Use your left hand to begin elevating your torso, followed by your right hand. Simultaneously allow your legs to lower off the bed, then exhale. We will now show you how to do a stretch from a seated position. Spread your feet shoulder width apart, then place your hands on your thighs and lean forward. Bend at the elbows and continue leaning forward until your forearms are on your thighs. Place one hand, then the other, clasping your leg below the knee. Slowly walk your hands down your legs while continuing to bend forward. After you touch your feet, bend your elbows, cross your forearms. The weight of your torso stretches your lower back. Hold this position for 10 to 20 seconds. Before you sit up, place your hands on your thighs just above the knee. Lift your torso by pressing your hands into your thighs and straightening your elbows. To get up, first take a deep belly breath and hold. Lean forward and lift your buttocks off the chair. Keep your hands on your thighs for support. Straighten your knees while tilting your pelvis forward. Move your hands higher on your thighs as you straighten. Once fully standing, exhale. Here is a side view of the correct way to safely stand up. Place your hands on your thighs. Take a deep belly breath and hold. Lean forward and lift your buttocks off the chair. Keep your hands on your thighs for support. Straighten your knees while tilting your pelvis forward. Move your hands higher on your thighs as you straighten. Once fully standing, exhale. Please see video 2, Facet Syndrome Self-Care Instructions, Strengthening and Moving Safely.